Cool.
Cool. So thank you so much for joining me, Nikki. So today, for part of our Mums of the Word remote series, we've got Nikki Hedder, and I've got the pleasure of being one of Nikki's athletes at a local gym. And I had the great experience, well, not the so great experience, of having quite a major sacroiliac sprain a couple of years ago, and that caused a real pelvic instability. And I was pretty out of shape in terms of it took a lot of care and a lot of rehab to actually get back to being my strong self. And it was that combination of getting some regular adjustments and then working on building that foundational core, building from the foundations up, that really helped me during that time. And learned so much about the role of exercise in women's health with my experience with Nikki. So I've invited Nikki to come in and talk to us today because it's really relevant right now because we're all at home and we've got this time to be able to do some exercise. So I thought we'd start off by, hearing a little bit about you and your background, Nikki.
Yes. Well, first of all, thank you very much, Dr. Sam, for having me. This is, it's an exciting opportunity actually to get out and reach a few people in their own homes, and maybe kind of something that we talk about today might resonate with a few of the women that are watching. So yes, I'll tell you a little bit about myself. I'm from the UK originally, and I have a degree in sport and fitness, Bachelor of Arts, and then I went on to do a postgrad in sports therapy. So I've always kind of had a real interest in the sort of biomechanics of how the body works, and sort of rehabilitation, prevention, that kind of thing. And then I've also loved traveling. So I found myself in New Zealand and got sort of into soft tissue work, which it found me rather than me finding it. And I'm glad that it happened that way. But yeah, so we now, I've done a lot of, I've got 3 boys, and so having children I've always been sort of sport. I've enjoyed exercise, I've enjoyed playing sport, and obviously having kids changes a lot, I guess, time-wise, and also the body changes. I mean, and I noticed it specifically after having Jane, my third, and I kind of tried to get back into doing what I was doing before, and realized that the body wasn't functioning as well. I didn't really understand what was going on, and my symptom was a diastasis, but everybody's sort of symptoms are a little bit different. So it just kind of triggered me to learn a little bit more about, we're in the world of exercise, and our demographic, certainly at the gym, that we own, RX Fitness 225, our demographic down there is a lot of mums, and in the same demographic as me, and so I felt like it was a duty, I guess, to learn a little bit more. So I've done sort of a lot of soft tissue training, but also now specifically postnatal core rehabilitation. So that's where I'm at, and I've found a real love of it, and I think a real connection with a lot of women, and there's always more to learn, but we're getting there, and we've found each other, which is great.
That's great. And that's one of the things you mentioned, a diastasis. So just for our viewers, so that they understand what that is, our rectus muscles, our abdominal muscles, are like a sort of a chain of muscles that run up and down, and they connect together. And as our babies grow, there's that fascia and that tissue can start to stretch and pull apart, and it can actually tear a little bit. And that those abdominal muscles are really instrumental in our ability to be able to hold our core and hold our pelvic floor. And when we don't have the activation of the whole abdominal kind of chain, then it can cause all sorts of problems. So that was part of my problem as well. That was part of my journey of how I got to know you and your work very well. Nikki, is a similar sort of problem after my third child as well, of having that rectus diastasis. And interesting enough, the irony of it, that's something that's tied a lot of, my patients and your athletes together, is
Right.
the management of that. So we're finding that, you know, working with getting the pelvis aligned, getting the adjustments, getting the body and the neurology firing well, but then actually going in and doing the appropriate rehabilitation and exercise rehabilitation has been just fantastic.
Yeah,
So
no,
I
it's
think
been cool.
yeah, it's really good. So I think one of the things that I want to talk about is we've got lots of mums that are at home at the moment and they're starting exercise at home. So I just thought I'd get some of your ideas around that and some of the things that mums can do and how can they do this and keep themselves safe, so not
Sure.
likely to injure themselves.
Yeah, sure. Look, I will always encourage movement of any description, really. I think what you have to think about when you're getting back into exercise or starting exercise after a long time, I mean, you know, there are two camps really. There's the camp of women that have, similar to me in the sense that they've been active throughout their life and they've stopped just to have their kids and then they're wanting to get back into exercise again, and you know, they feel like their body is still the same as it was before. And so there's this rush to sort of get back to doing what you were previously doing. And then there's the other side where there's women that may not have been doing anything for years, you know, and want to get back into it. I think really the key behind it is understanding the reasoning why you're getting back into doing it again, or starting, and it really is important to get the whole focus of the aesthetics of the body and what it looks like, and you know, the six pack or the bikini body or whatever it is that is marketed out there for us all to look like post baby. You know, I think that's really got to get thrown out the window, and the approach has to be as a health and well-being, and you know, doing it for yourself and for the mental health and other aspects, you know, the well-being of it. So that's, you know, from my perspective, and I know from yours as well, that's it's the holistic approach of bringing all of these things together, and exercise being something that is an enjoyable experience, and it's really building, like you said, the foundations from the inside out, and eventually, you know, the subsequent weight loss or bikini body or whatever that may come of it or may not, you know, it's not the all be all and end all. And I think the main reasoning, getting back to your question, would be certainly I would encourage it. I would encourage movement. I would encourage whatever that looks like in people's worlds. Right now, you know, a lot of people are getting the opportunity to go out for a walk, obviously, in a safe distancing, but you know, anything that gets you out into nature, gets you moving, gets you breathing, and we'll go into breathing, I know, but
it's really important that that women have a really important why. Why are they doing this? I think that's what I've gathered from what you said is looking at their motivation. And the health and fitness industry has actually in the past been quite damaging to women in terms of basing so much around body image. And so I think what you were explaining about a woman having a really good why are we doing this? And we're doing it for ourselves, and we're doing it for our tamariki, we're doing it for future generations. We're doing it because we want to be better within ourselves, and not necessarily because we have a bikini body or, you know, whatever. Yeah, so looking at the why is really important. So there's so many different exercise programs that are available out there. Like you've been running a fantastic online one for your members, which has been brilliant, and I've noticed that you've got a few new members come in.
We do. I know. It's very exciting. It's a great opportunity.
Cool? Yeah. That's really cool. So you've had some new members join, which is fantastic. While we don't even have the gym open, they've just been coming online and joining into the community. But there's also lots of other online fitness programs and things like that available. How would you, like, for someone that's just coming back into fitness, say, you know, they haven't exercised in a number of years, like you described, that sort of that type of person that's come back in after a number of years, would you recommend that they do one of these online programs, or would you recommend that they do like what you've just described, getting out in nature and walking and doing something a little bit more gentle to begin with?
Yeah, I that's a good question. I think again, it depends where you're coming from and how much body awareness you have, because I think body awareness is a big aspect of exercise, and we'll get into sort of the strength and the strength versus cardio and things. But I think always it's important to start gently. Always be kind and be gentle to yourself, and not have the expectation of, these online is wonderful, and in this day and age at the moment, it's a really good way of doing it. There are some, I would always encourage people to look into the credentials of the people that are putting them on there, and that's purely because you really need, when you're sort of postnatally, it's not fear mongering or scaremongering. I encourage movement entirely, but there's safe ways to do things, and there's never a yes you can and no you can't, but there's just maybe not yet, and so having somebody that is got experience in sort of pregnancy and postnatal training, and has alternatives. So if there's dynamic exercises, which for some people are okay, and for some people they're just not quite ready for the dynamic work.
So dynamics like jumping and stuff? Dynamic is more jumping.
Yes, exactly. So, yeah. So jumping, skipping, there's a lot of sort of single leg exercises, lots of core exercises out there that are really advanced that, even for somebody sort of 2 or 3 years postnatal can still be challenging. And you find that in yoga, you find it all over the place. It's just having a guiding force to kind of understand where you're at, what's kind of safe, and listening to your body is one thing. But for some people, those cues are also quite challenging, because you're not quite sure, if you don't have the body awareness, whether that's appropriate or not. So always start gently. I would encourage people to get moving, get breathing, get walking, and then sort of, find sort of a strength program over a cardio program initially, and have somebody be able to guide you through that. I think that's important.
Excellent. Can we talk about that a little bit, Nikki? Like the strength versus cardio, and why it's important to build the strength foundation?
Yeah. I think this is actually not just beneficial for pregnant or postpartum women. I think it's actually really important for everybody. Yeah. And a lot of what I talk about is really relevant for males as well. So, when we talk about sort of pregnancy, postpartum, pretty much what I'm going to say now is really important for everybody. But I think specifically for the postpartum sort of demographic, we kind of feed back into the weight loss and things like that. And I think a lot of women particularly feel like they talk a lot about their baby. I need to lose my baby weight. I need to lose this. I need to lose. And that starts very early in the mentality of women postnatally. And I think the first thing that people want to do is go running. And that's what a lot of people tend to do, is go running. And I think the important thing to understand is, if we can imagine what's happening when we're running, there's a huge amount of load that's shifting through the pelvis, from the ground up, so that you initiate a load from the ground, and that whole load is shifting through, and it has to come through the pelvis to move you through that movement. And I mean, if we struggle to even kind of sit up and sit down on the toilet and stand up, for example, without kind of having to grab onto something to help us raise our body up off the loose seat, I mean, that's an example, then you can't really expect to be able to hold your body weight on one leg, and then you're making that a dynamic movement. So there's a whole load of shear force that's happening through that pelvis that I think people underestimate, and it's good to understand that why walking is a good start. But the strength is really important, because the pelvic floor, and we'll go into it, but the pelvic floor is not just when, you kind of associate, if you're going to wee yourself, for example, people are like, oh, my pelvic floor is weak because I wet myself when I jump on the tramp, or I leak when I sneeze, or whatever. The pelvic floor is not just that muscle that stops the wee coming out. There's the hip, everything that's attached to the pelvis. So every muscle. Yay, Dr. Sam. That's awesome. So you've got your glutes, like your buttocks, basically, which are a huge part of our pelvic floor, and are basically one of the biggest muscles that switch off through pregnancy, because the shift in the center of gravity, you know, the glutes switch off and they're like, okay, you know, we sit into our hip flexors. There's lots of things that happen, but the glutes then kind of go to sleep for a short period of time. And then, of course, that supportive structure is not there for the pelvis. And so building glutes, getting really good, nice, strong bum muscles. I'm a big fan of centimeters increasing, not decreasing. You know, if we can increase the circumference around our buttocks, I'm a big fan.
Yep, it's all about the booty.
It's all about the booty.
Yeah.
For all the right reasons. So glutes, and then, you know, everything that sort of attaches to it, and that helps to strengthen and support the pelvic floor. And so also, you know, talking about the diastasis, you've got all these core muscles. Lots of people focus a lot on that six pack, but actually, really, it's the ones that sit underneath that are so important. And you can actually be stronger postnatally than you ever were before, if you learn. Yeah, I know, and me too. I mean, I'm so passionate about it, because I feel much stronger now than I ever did pre, and I was pretty strong, and I've always been athletic, but I feel so much stronger now, and I understand the body so much more, and that's why I love to talk about it, because it really works and it helps. Yeah,
it really does. So it's so for women actually wanting to come back into some exercise, just so I can recap what you've talked about, like being really gentle. So don't just come straight back into blasting out some cardio or running or things like that, because we've got to understand that the changes that happen within the pelvis that are appropriate for growing a baby and housing that baby and giving birth to that baby do mean that we are a little bit compromised from a structural perspective postpartum. Sure. And if we don't work on rehabbing that, then that can actually carry on for years. Like in both yours and my scenario, it was actually a number of years later that we were still having the hangover of having had 3 children, and not getting the activation of those muscles properly. So the activation of those muscles is just so important. So building booty, doing some really good glute work. Yeah, absolutely. Yep. And building that strength, building our foundation, because the way that I describe it to my practice members is like the pelvic floor is the floor to everything else. It's what's holding you up against gravity. And so if that's not working appropriately, you don't necessarily wet yourself like you described, but you'll have the lower back issues, and you'll have the pelvic issues, and you'll not
hip
be able
pain.
to hip pain and things like that. Like you'll have all this other symptomatology. So building those muscles of the glutes in particular are really important.
And the breathing, which we'll discuss. I mean, I say to a lot of the women that come and see me, is that, you know what, you don't have to do a sit-up for the next like 3 months or whatever, and I can guarantee if we get you breathing properly, you can build great abs just by breathing. And you can get a burn if you're activating correctly and you learn how to activate. You can build great abs through just breathing. And
Did you hear that, ladies? Did you hear that, ladies? We don't have to do a sit-up. If we just breathe well, we're gonna build good abs. Yeah, and then learn to stabilize the pelvis, and then you can get into all of that dynamic stuff that people love to do. I mean, people like to do it, but for sure, that's a really good way of describing it. So with breathing, Nikki, can you explain like how that works, like what the importance of breathing in the pelvic floor is for our ladies?
Yeah, for sure. So, gosh, I kind of describe, I use balloons a lot, because I try and describe our system as kind of we're one big pressure system, I guess. And we have kind of different parts to us, but if we're talking about sort of the abdominal cavity, so if you imagine, many people will have been taught to breathe into their bellies. It's like belly breathing, that kind of stuff. There's a synergy or a great relationship that should exist between the diaphragm, which is your breathing muscle. So every time you inhale, it sits under the rib cage, and every time you inhale, your diaphragm should come down. Exactly right. And that helps to inflate the lungs and so on and so forth. So what happens is, in an ideal world, if you can see my other hand, so this is your diaphragm and this is your pelvic floor. So in an ideal world, when you inhale, your pelvic floor should relax. All right, so this should sort of happen. So the pressure system that sits in the middle here isn't compromised, because you've got this lovely balance between the diaphragm coming down, and then sort of the pelvic floor absorbs that pressure, and then it sort of comes up and down like this. So in an ideal world, that's what happens. But obviously, when you become pregnant and the baby grows, your ribs shift, everything kind of gets out of whack a little bit. And just because we lose, the baby comes out, that pressure system has to learn how to function again optimally. And sometimes, the pelvic floor gets quite tight and it holds, and, your diaphragm comes down, and then we've got this pelvic floor holding. And so that pressure has to go somewhere. So if the pelvic floors are absorbing it, it's going to go out. So it could come out through a diastasis that's sort of sitting out the front here, if you imagine this is the tummy. Or, if you have a weakness anyway through the lower back or a disc, for example, that pressure is going to go to the point of least resistance. I mean, pressure always goes to the point of least resistance. So if we're weaker through here, then obviously the diastasis is going to find it difficult to heal. If you're, otherwise, if you're slightly weaker through the back, then, you're probably going to be getting that SI joint pain, that lower back pain, that non-specific pain that you can't put your finger on particularly, and you don't know where it's come from. Yeah. So that's all pelvic floor, and that's how the breathing it's just learning how to absorb that pressure, and that includes sort of rib movement, rib mobilization, pelvic floor relaxing, contracting. It's just reconnecting, I guess, to the pelvic floor again. Yeah,
I think that's the best description I've ever heard about the pelvic floor needs to absorb the pressure, otherwise it's going to go to the point of least resistance, which tends to be the symptoms that I see in my practice, as where you're getting that pressure, that disturbed pressure distribution. One of the points that you made there is that the pelvic floor can sometimes be like it's not giving. And so we often relate like a weak pelvic floor to a pelvic floor that's flaccid and it's not contracting. But in my scenarios that I see in the practice, as more often than not, it's women that are actually over contracting the pelvic floor, or that the pelvic floor isn't responding appropriately. So unlike, when we have a muscle, we should be able to contract it and relax it. And sometimes the pelvic floor doesn't respond appropriately. So it's either switched on too much or not switched on enough. Can you maybe elaborate a little bit more on the overactive versus underactive pelvic floor, please?
Yeah, definitely. Again, that we're talking symptoms here as well. So, there's a lot, when you think about pelvic floor symptoms, people think of incontinence. That's one of the main things that people come in and go, oh, and I described it before, it may be, jumping on a tramp or sneezing or coughing, or you fall off a curb and you have to catch yourself and you're like, oh, it feels, the pelvic floor feels weak, or exercising, lifting, or, there's lots of different things, and I won't go through everything, but we'll talk about incontinence as one thing, where often and the rehab that you're given is often Kegels. So people will go, oh, I've got a weak pelvic floor because I can't hold my urine in, or I need to go to the toilet and I can't hold my urine and I have to run to the loo when I need to go. So, the automatic response to that is, I've got a weak pelvic floor. So it's, it's been overstretched, it's not strong enough. And so you're given Kegels to do, the Kegel being, contracting and relaxing your pelvic floor. So you contract as if you're trying to stop a wee, and then you relax it, and then you contract and relax. And so that can be really, really helpful for an underactive pelvic floor. So one that is actually weak and has been lengthened and it needs strengthening. And then we've got the opposite, which the symptoms are the same. So you have an overactive pelvic floor, which is a pelvic floor that, like you say, is holding for one reason or another. Now, there's different reasons why that might be. So the pelvic floor is an emotional muscle. So it's connected very much, sorry, there's a fly. It's connected very much to your emotional state. So if we talk about stress or anxiety or, you know, you've suddenly got this new baby, and just like you would contract your jaw when you're kind of stressed or upset about something, the pelvic floor does the exact same thing. So it reacts and it holds. And if you're holding tension, a lot of tension tends to be held in the pelvic floor subconsciously. So there's that. There's also the weakening of the glutes and the other structures that support the pelvis. So when someone's not doing their job properly, something else has got to kind of take over. And so what tends to happen is if the glutes or the hip flexors or the adductors or the core itself isn't supporting the pelvis, and the pelvic floor is the only guy doing any work. And so he's holding and holding. And so then if you imagine, you know, I guess I describe it very much like if you're clenching your fist and you're constantly clenching your fist, and then someone goes to you, now clench harder, you know, it's like, oh, I'm so exhausted, I haven't got the energy to bring in anymore. So say you are holding and your pelvic floor is holding for a long period of time, and then you go to jump on a tramp and you need your pelvic floor to hold, it's got nothing left to give. Does that make sense? So it's kind of like, it feels weak, but actually it's just trying really, really hard. And it needs to learn how to relax. So like you say, every muscle needs to relax in order to be able to contract. So the breathing is twofold really, and I'll explain that, but that helps to relax the pelvic floor so that when you need it, you can bring it in. All right. But every muscle must relax in order to contract.
Yeah, that's fantastic.
I hope that makes sense.
Yeah, no, it was really, really good because, you know, like again, the presentations of an overactive pelvic floor are huge and varied, like you say, where like the pelvic floor is on too much. It generally tends to neurologically switch off the glutes, and we tend to get like overfiring of the hip flexor muscles to kind of take over a little bit of that as well. So it's a really common presentation. And the other thing that happens with that, which women will often discuss, is that dyspareunia. So the pain during sex as well can be another symptom of the overactive pelvic floor.
Exactly right.
Yeah, which often they put down to, well, it's because I've had a baby and there might have been some damage or things like that. But in actual fact, it can, if women can learn, particularly through breathing, in order to be able to relax the pelvic floor, it can make that a lot more comfortable and enjoyable for them. And
I think, you know, that in itself brings anxiety and stress to an already quite stressful situation. So I think that, that's a really important point, that is a symptom, and it is something that can manifest itself into more anxiety, more stress, and more symptomatic. So if you can get on top of it with that, that's awesome. Yes, for sure.
And breathing is just such an important thing. So one of the things that I was hoping that you could do is when we post this video, we're going to put some links in the comments below with some of the techniques that you actually work through with women, Nikki. That would be fantastic.
Yeah, for sure. Yeah, I can give you a couple of good ones. That's no problem.
That would be fantastic. Now, I guess like the breathing again, we talk about like the breathing in terms of being able to get that pressure constant in our abdomen and engage our core. We talk about the breathing in terms of how it regulates the pelvic floor in order to be able to relax it. But also breathing is really important for our nerve system. So do you want to just talk about that a little bit? We kind of touched on it a little bit with the anxiety, but I thought maybe we'll finish up with talking a little bit about how breathing as part of exercise, a really important part of exercise, can actually help us with some of those anxieties.
No, definitely. So the nervous system, it's so important in the healing process, and I think parts and parcel, like one of the main things that certainly I discuss, you know, and it's an open forum. I think sometimes women just need a platform or somewhere or someone to kind of offload a little bit. And without realizing, we can hang on to a lot that we don't realize that we're hanging on to. And that can be the trauma from the birth. It can be trauma of the emotion of the body not feeling the same, or we don't have a connection to the baby that we thought we were going to have. There's lots of emotional trauma that doesn't often you don't often process initially until you allow yourself that opportunity to offload and to really think about it. So the body finds it very, very difficult to heal when it's stressed. And so when we're talking about coming in, women will come in and they'll go, I just need to fix my pelvic floor, or I need to fix my diastasis. And all of these things, they're not things that need fixing as such. I think it's just something that you begin to unpeel the onion. And I think the breathing is like the foundation of that, because it helps in all aspects of it. But you have your fight or flight. We'll talk about it in this way. So you have your sympathetic and parasympathetic nervous system, but in layman's terms, it's your fight or flight, and then your rest and digest. And often we live in a world where we're in this fight or flight without even realizing that becomes our new normal. And so your nervous system is ready for stuff all the time. Your pelvic floor reacts to that, and then you get your symptoms. So the breathing is the one thing, and I start everybody on breathing. It doesn't matter if you've got an overactive, underactive, whatever it is. The breathing is fundamental, and I think it's undervalued hugely. And I think once women understand the power of it, it becomes something that just becomes part of your life. And you can use it through exercise, you can use it through meditation, you can use it in all sorts of ways. But so the theory behind your breathing, and there's ways of doing it, but it's that real deep breathing. It's that nasal breathing, and then exhaling through your mouth, inhaling and exhaling, and getting your breath through your abdomen, through your ribs, and into your back as well. So it's like a 360-degree breath that we're looking at getting. What that does is it triggers the vagus nerve. So the vagus nerve is part of the parasympathetic nervous system, and it's the only way. If you don't trigger that vagus nerve, there's no way of hitting that rest and digest. So you need to trigger that nerve, and the only way to do that is by breathing and learning how to connect and get that lovely deep belly breath. And you'll be able to explain that way better than I can, and Dr. Sam Haitsma. That's how I explain it to my ladies, and it helps to settle the system. And I just say to people, we need to settle the system, because until your system is settled, there's no healing that's going to take place.
That is fantastic. That's fantastic. It's absolutely like when I describe like the difference between that fight or flight or rest and digest with practice members, one of the very first things that I recommend to them is the breathing. And just having benefited from the breathing work that you've done with me is great from a relaxation perspective. Actually, just sitting here listening to you, I was redoing my breathing techniques and relaxing my pelvic floor. And also in the middle of a workout, I could be lifting a really heavy barbell and I've got Nikki in the background going, breathe, breathe. Yeah, it's fantastic, because until we actually really sort that breath out, none of the healing can take place. And that's what we're working on doing with our mums, with our women in our community, is working on that generational healing. So thank you so much for your time, Nikki. It's been fantastic. And I just could talk to you for hours on this. And I know that our communities are going to really benefit from the conversation that we've had. And I'm just really grateful. So thank you. I'm going to put some links below for some of this breathing work. I'm also going to link RX Fitness 235, which is the gym.
Bless you. Thank you.
And look forward to catching up with you again, Nikki. Thank you.
Yeah, thank you, Dr. Sam, and thank you for the opportunity. I've really enjoyed it. I love talking about it too, so hey, anytime.
That's great. Thank you.